Court Reporter with Stovall and Associates.
Welcome back to Court Reporter. I'm your host, Mike Iglinski. Tonight we've had Larry Harrison. Before we went to a first commercial break, we were talking about healthcare, physician's assistants, and how really you think that we might see a less hands-on approach because of some of the new things that have come through the Affordable Health Care Act and you know, just in general. I guess It's been the changing of the business of medicine.
Right.
Well, to go back onto topic, though, you know, we started talking about the Patient Protection Affordable Care Act, i.e. Obamacare, as most people have been calling it, I guess. You know, you went and you started talking about the cost associated with it. Now, we've seen rising costs, you know, from the patient-by-patient basis. What is this going to do? Do we know? I mean, do you have any inkling as far as what we're going to end up seeing? Where's the money going to come from? Is it more? And whose pockets is it going into?
Well, initially, there's many subsidies that are coming from the federal government. Nevada has just signed on to a contract for $72 million with Xerox to implement a computer system that is going to help streamline the implementation of what they're calling the Nevada Silver State Exchange. Mm-hmm. And the exchange is where the consumer will go to review benefits or plan designs that are available, and they're calling them the metal tiers. So we have a platinum, a gold, a silver, and a bronze package, and then each of the different insurance companies can offer plans in each of these different categories, up to 5 different plans in each one of these metal tiers. Then the consumer can be given funds to buy into, as an individual, into the silver plan, as an example. And that money is going to be federally
They'll be getting
subsidized.
a voucher.
A voucher.
Okay,
Mm-hmm.
and then they choose
which plan design they want.
Right,
Mm-hmm.
okay.
Okay, now, the feds have a great advantage over the state of Nevada and all other states. The feds can print money. And the money runs out come 2017. And one of the biggest problems that Nevada is going to have come 2017 is where is the $500 to $750 million going to come from? These are not my numbers. This came from NPRI, the Nevada Institute Research Policy Institute.
Yeah,
right, Nevada Research Policy Institute, or NPRI. So at any rate, $500 to $750 million annually. Well, unlike our surrounding neighbors, California, Arizona, Utah, Idaho, they all have a state income tax. Nevada does not. Mm-hmm. So is that going to be an area where they're going to fund families making up to $90,000 a year to buy health insurance? This would be a family of 4, up to 400% of poverty level will qualify for a subsidy. This is expensive.
What do you have an idea as far as what's the dollar amount on the subsidies, say, for a family of 4? Like, let's say at $50,000, which happens to be the median household income across the country. But at $50,000, what type of subsidy does a family of 4 get?
Let's say around about 50%.
50%.
Mm-hmm. And so that's a moving target. But the point is where's that money going to come from?
Right.
You know, that is the problem. And there are many, many problems with the implementation of the Nevada Silver State Exchange. One of them has to do with essential benefits. Every plan must meet a federal guidelines of essential benefits, but it's up to the state of Nevada to orchestrate this. Well, there's nobody to do that. So they've given it back to Health and Human Services and said, you come up with essential benefits because it doesn't make sense for us to figure it out.
Let me ask you this. Since we're talking about a minimum requirement of essential benefits to be given to the citizen of Nevada, do we today have the healthcare providers that would be able to actually provide the services that we're going to see with this new larger pool of people that will have a subsidized benefit?
Yes. And ideally, what we really need to do to address the costs of healthcare is to have transparency. There are insurance companies, not in Nevada, that if a person is insured in California and they happen to be on vacation in Ohio, they can just swipe their card and they can find out every medication that they're on or have taken, what they're allergic to, and it doesn't matter if they're in their immediate service area or not, because they have transparency. So that's what we need in order to help keep costs down. If somebody's hurt in Pahrump and now they end up, well, we can't accommodate them here, they need to go to the nearest hospital in Las Vegas, and they get there and they say, we can't accommodate you here. In the meantime, we do an MRI in Pahrump, we do an MRI at the first hospital, and we get to the third hospital, and they do yet another MRI. That's extremely expensive. It should be we do one MRI, and that information is transferred, and it's an interoperable computer system. That's what we need. And
you say there's already states that have implemented this that keep within the compliance of HIPAA.
Insurance companies do it.
Insurance companies,
yes.
Okay,
and it is obviously HIPAA compliant, which is the Health Insurance Portability Accountability Act. Most people think of it as the Privacy Act because, again, the HIPAA law, 1996, it's taken over 10 years to get the language into it, and now it's become the Privacy Act.
Right.
Although it is still a part of the portability.
Right.
Okay.
Okay. So I guess now we addressed the cost. Now, let's kind of scale it down to Joe Q. Public. Okay. As we see the Affordable Care Act come into effect, if we do, and like we gave a disclaimer at the beginning of the show, kind of depends on what happens in November. If it was to survive, what is the average family going to see happen to them? And I'll give you two hypotheticals. One, the person who has an employer-provided health care plan, and the other one who might be reliant upon things like UMC's ER and however they can afford their health care, paying some type of cash per case instance.
So let's take the individual that's buying health insurance today. They're going to see rate increases someplace between 100 to 200% rate up from what they're currently paying. Okay? And the other part of this go away. The other part of this is the employers that are offering benefits. They have a choice of either offering benefits to their employees or paying a fine. The fine has been labeled a tax. So it is truly a tax. And the tax is $3,000 per employee annually. Well, if the employer chooses not to do it, it becomes a tax grab for the federal government. And that's really what this bill is doing, is it becomes a tax grab with fines for the employer and fines for individuals that don't buy health insurance.
Of course, our legislative branch is allowed to tax people on a free basis through a bill, correct, right?
Through a bill. But this, and that's exactly what happened here. But we were told it wasn't a tax, and now it is.
Now it is a tax, right. Okay, so we have a tax grab for people that well, let's say the $3,000 fine from employers. Now the person who does not have health care insurance that is being paid piecemeal, do they have a new benefit in place that for social welfare helps?
There's an expansion of benefits, however, it still isn't addressing the cost, and that's the problem. And expanding of the benefits, when we spoke earlier and we were talking about the individual buying an individual policy, and I said that we get guaranteed issue for individuals, infants to 19-year-olds. Well, today, there are no individual plans available for an infant or for a child that's 16 or 17 years old. Only if they go on with mom and dad, or if they go through an employer-sponsored plan. And the best place for people to get their health insurance is through an employer. So be sure and ask your employer to get engaged with offering health insurance benefits. They help subsidize the premium for the end user, and it's also they attract quality employees and they retain quality employees, and that's why they call it employee benefits.
We're going to take our second break, and then we'll cap our conversation. Okay, we'll be right back after this commercial.
Court reporter with Stovall and Associates.